So let me share with you my specific basic strategies to promote adherence. Number one, make sure you act in such a way that the patient trusts you and you hold them accountable. Then simplify the treatment. You know, I believe all this talk about moisturizers and bathing is topical calcineurin inhibitors is well and good, but if you make the treatment too complicated, it's not going to work. I know that topical triamcinolone works because if I took a patient with the worst total body atopic dermatitis and refractory to everything and admit them to the hospital and put triamcinolone on them in the hospital, they'll clear up in just 2 or 3 days. So I believe a simple treatment regimen may be the best treatment regimen. If I want people to use multiple things, if there's combination products, I kind of like that. For teenagers, well, I know what teenagers want to be like. They want to be like other teenagers. So if I'm prescribing therapy to a teenager with atopic dermatitis, I'll tell them, this is the medication most teenagers are using for their atopic dermatitis. If mom is concerned about risks and side effects of steroids, well, I just won't use the word steroid with her. If she asks me, is this a steroid? Using a technique I learned by watching American presidential debates, I say to her, well, I just don't answer her question. I answer a different question. She says to me, is this a steroid? I say, this is an all-natural, organic, gluten-free anti-inflammatory made in a nut-free facility here in America. The immune system is out of balance in atopic dermatitis, and this medicine will bring the immune system back into balance and harmony, because I like to take a holistic approach to the management of atopic dermatitis in children. I try to remember to give all the advice I want patients to know in writing. And then you might think I bring the patient back for a return visit shortly after starting therapy. And I don't do that. I tell the patient, you know, I really want to know how this works. It should work quickly. I'll see you back in 1 week. And then I say, no, then you'd have to miss school or work. You'd have another copay. Let me write down my cell phone number for you. You call me in a week, or using the electronic patient portals we have with our record system, send me a message through the electronic portal in 1 week and let me know how this is working. Or for a patient who's highly refractory, which means they're very likely non-adherent to treatment, I'll tell them, send me the message in 3 days, because I really want to force them to fill that prescription. I want to get them to use the medicine and get in the habit of using it. By seeing that it works, they get positive reinforcement, and they see good response. Then they know they can clear their disease when they need to with the medication.